Welcome to The Explainer. Today, we are opening up the medicine cabinet to talk about the hidden risks and, believe it or not, some surprising benefits of common supplements and therapies, especially if you're preparing for surgery.
So, if you or someone you care about is heading into an operating room soon, there is a super critical conversation that you might not even know you need to have. And it's not just about the surgery itself. It's about what you've been taking beforehand.
Okay, get this. 70%. That is a huge number. And it's the percentage of patients who, well, they just don't tell their doctors about all the herbal medicines or supplements they're taking before a surgery. Let's dive into why this really common habit is actually a massive safety concern.
All right, first things first, let's get on the same page about what we're talking about. The official term you'll hear is complementary and alternative medicine, or you'll see it as CAM.
Now, this is a huge umbrella term, right? It covers everything from the vitamin C on your kitchen counter to ancient practices like acupuncture, and its use is incredibly common. In fact, studies show that surgical patients use these CAM therapies even more than the general population does.
So, why does this matter so much? Here's the key thing to get. These aren't just harmless little vitamins. Because they aren't regulated like prescription drugs, their purity and how strong they are can be all over the place. A lot of them have powerful drug-like effects that can mess with anesthesia or your body's ability to, handle the stress of surgery. Let's look at how this plays out with a few really common examples.
A lot of really popular supplements can pose some serious risks around the time of surgery. They usually fall into three main categories that, let me tell you, anesthesiologists really worry about.
So the big three concerns are bleeding, messing with the anesthesia, and something called drug metabolism. Herbs like garlic can thin your blood, which is not what you want in surgery. Others, like kava, can make the sedative effects of anesthesia way too strong. But that third one, drug metabolism, that can cause some truly chaotic problems. To really get how serious this is, let's zero in on one of the most popular herbal remedies out there, St. John's wort.
St. John's wort. A lot of people use it for depression, but in a hospital setting, it can be an absolute wild card. It's really the perfect example of one of these hidden dangers. Here's why.
Okay, so your body has this amazing system for processing drugs, and it's run by a group of enzymes in your liver called cytochrome P450. The easiest way to think about it is like your body's main drug cleanup crew. It's in charge of breaking down pretty much everything, from the anesthesia you get in the OR to the critical meds that keep organ transplant patients alive.
And this is where the problem starts. St. John's wort essentially hijacks that cleanup crew and kicks it into hyperdrive. So now, these supercharged enzymes are flushing all these other essential drugs out of your body way too fast. All of a sudden, life-saving medications like cyclosporine for organ transplants can just become useless. And this can lead to absolute catastrophes, like the body rejecting a brand new organ.
So what's the solution to all this? Well, it really just comes down to two simple things: knowing what's what and timing. Knowing what to stop taking and when to stop taking it is the absolute key to a safer surgery.
This table right here lays out the most critical info for some of the biggest offenders. And what's really essential to notice is the timing. Look at that. For many of these, like fish oil and ginseng, the recommendation is to stop a full 2 weeks before your surgery date. Not a day or two, 2 weeks.
And seeing it on a timeline like this just makes it even clearer. Your safety countdown doesn't start the day before you go to the hospital. For so many of these common supplements, it has to begin a full 2 weeks ahead of time to give your body a chance to completely clear them out.
But you know what? It's not all doom and gloom. It's not all about risk. It turns out some of these non-herbal CAM therapies can be surprisingly helpful for surgical patients.
Let's start with acupuncture. I think a lot of people just think of it for, chronic back pain or something. But a growing pile of research shows it has very specific, proven benefits when it comes to surgery.
Researchers have found it can help on a bunch of different fronts. It can calm your nerves before you even go into the OR, it can reduce how much powerful anesthetic you need during the procedure, and it can even lower the need for opioids to manage pain afterwards. And the best part? Side effects are incredibly rare. In fact, one of its most well-documented benefits is how effective it is against that awful post-op nausea and vomiting, or what doctors call PONV. Just stimulating one specific point on the wrist, known as P6, has been shown in some studies to work just as well as anti-nausea medication. How cool is that? And it doesn't stop there. Other really simple, non-invasive therapies have shown real benefits too. Things like slow, gentle, deep breathing can actually reduce pain and nausea. And music therapy, specifically letting the patient pick the music, has been shown to lower anxiety, blood pressure, and even how much sedative medication is needed.
Okay, so we've covered the hidden risks in your supplement cabinet and the unexpected benefits of other therapies. And all of this brings us to the single most important takeaway from this whole explainer.
With all of this info, all the risks, the timelines, the potential benefits, what is the one single action that ties it all together and really protects you?
It's a simple 3-step plan. First, make a list. I mean a list of everything you take. Every vitamin, every herb, every tea. If it goes in your body, write it down. Second, don't just bring the list. Bring the actual bottles with you to your appointment. Let your team see the exact ingredients for themselves. And third, and this is the most critical part, have the conversation. Talk openly, honestly with your surgeon and, I can't stress this enough, with your anesthesiologist.
You've got to remember, your anesthesiologist is your partner in safety. Giving them the complete picture isn't about getting judged, it's about protecting your own health and making sure you have the best, safest outcome possible.
It really makes you wonder, doesn't it? If the stuff in our supplement cabinets can have such a huge impact on something as serious as surgery, what other hidden variables in our daily lives might be affecting our health in ways we haven't even thought about yet? Thanks for watching.